Um, okay, hi everyone. Sorry I didn't give an introduction to Bernie. I was doing a presentation in the other room and we had some great questions and dialogue afterwards, so I was here just a couple minutes late. But our next speaker is Jennifer Hackler, and she's been with Kaiser Permanente for 4 years, and she runs the Six Sigma program for their Claims Connect program in California. She's worked in other roles in Six Sigma, and she's a certified Lean Six Sigma black belt, certified associate in project management, and a certified systems engineer, and has her bachelor's degree from University of Illinois in business administration and information systems. And I think it's great in her bio. She was awarded the 2011 Kaiser Permanente Circle of Distinction Award for exceptional performance. So we hope to hear some great things. Welcome, Jennifer.
Well, you didn't show me how to use this, but okay. The green button. Got it.
It's pretty easy and there's no laser.
Okay. Excellent. Thank you. Good evening. At this point, I'm Jennifer Hackler with Kaiser Permanente. I'm going to speak tonight a little bit about adapting Six Sigma to what we call mega programs. We have a booth outside, and I have two of my colleagues with me, Annette Compton and Senling Liu. So if you have questions during cocktail hour, please feel free to come ask us. I'm going to move through the slide presentation as quickly as I can so that everybody can have a drink, because I know I need one. So before we get into adapting Six Sigma, I'll talk a little bit about Kaiser Permanente in general. Kaiser was founded in 1945, and we have about close to 9 million health plan members across the United States. We have a little over 167,000 employees, close to 15,000 physicians, 35 medical centers, and 431 medical offices. We are what we call an integrated managed care consortium. And this consortium is made up of 3 distinct groups of entities. So we have the Kaiser Foundation Health Plan, which is what we work for. We also have the Kaiser Foundation Hospitals and the Permanente Medical Groups, and these are regionalized. So the health plan is not-for-profit, as well as the hospitals, and the hospitals are funded by the health plan. The medical groups, however, are regionalized, and they are for-profit organizations. Our technology, as you can see the circle around the outside, is nationally based and is run by KPIT. And each region maintains their own configurations necessary to be compliant within their region or state. One of the larger projects that you may have heard of through Kaiser Permanente is KP Health Connect. And this is the electronic medical record project that we worked on for many, many years. And I'll talk about that in just a short bit. So Kaiser generates about $1.6 billion a year in net income, which is then reinvested into all of our hospitals and medical offices, as well as the technology to support our care delivery model. So some of our immediate goals in the next 10 years would be to double our medical offices by 2015, double our hospital sites by 2020, and then continually reinvest in our technology. As I mentioned previously, KP Health Connect is the most recent project at KP, the largest mega program at KP, and this supports our EMR nationally. And that also is an improvement for the foundation hospitals and medical groups. The project that we are working on is KP Claims Connect, and that is focused on the health plan. It's been going on since 2008. And we anticipate our first go live in 2013. So what is a mega program? A mega program at Kaiser is any project or program that is over $100 million and typically spans many years. As I said, KP Claims Connect is in its 4th year and will cost over $300 million at the time of implementation. We currently have 280 employees that are dedicated just to this project. At Kaiser, there are about 14 mega programs totaling around $2 billion that we'll implement over the next several years. And a PMO is created for each mega program. So many of these mega programs at Kaiser have actually failed, including the last 2 attempts at implementing a claims system within Kaiser. So obviously this has cost us a great deal of money, because once you get into a couple of years and a couple of $1 million of investment, you certainly don't want to stop a program. So what have we learned over the years? First, we learned we don't capture business processes well. Actually, IT would document all of our business processes, which is slightly scary to me with an IT background. And second, we would document our business processes after we would implement them. Not sure how that happens, but it happens. Second, our antiquated technology provided little to no useful data, and it certainly was never married with process. So our root cause analysis could sometimes be misleading or entirely wrong. Third, the size of these programs and the large number of stakeholders is difficult to manage without process and data. So imagine if we have 280 employees that are dedicated to this project. Our number of stakeholders is probably near about 1,000. And this is a very collaborative environment where everyone participates in making decisions and feeling as though they're part of this engagement. It gets a little difficult to manage all of those relationships, especially without process and data.